let's forget all the talk about AI replacing jobs for a second. What if, especially in a field like healthcare, it's not a replacement at all? What if it's actually a revolutionary new partner? Well, today we're going to look at how AI is becoming an absolutely essential co-pilot for doctors, for nurses, and yeah, even for you.
This quote from Dr. Rajiv Singhal, it just hits the nail on the head. AI isn't about taking over the cockpit. It's about having a vigilant partner right there with you, helping navigate the incredible complexities of modern medicine. That's the core idea we're going to unpack.
And look, don't think this is some sci-fi movie set 10 years from now. This is happening right now. Just take a look at India. Its healthcare sector is at this incredible turning point, where the massive scale of public need is meeting the unbelievable potential of technology. I mean, the stakes are super high, but the opportunity for transformation, it's even higher.
So why the big rush? Why is this change so urgent? Well, it's because traditional healthcare is really at a crossroads, stretched to its absolute limits. A fundamental shift in how we do things isn't just a nice idea anymore, it's a flat-out necessity.
You know how it usually works, right? For decades, healthcare has been reactive. You get sick, then you go see a doctor. AI lets us make this massive pivot towards being proactive. It's all about using data to predict and prevent illness before it even gets a chance to start. This isn't just a new tool, it's a completely different philosophy of care.
And we desperately need this shift because, let's be honest, the current system is under enormous pressure. I mean, think about it. Patient data is all locked away in different systems that don't talk to each other. We're facing critical shortages of doctors and nurses right as diseases are on the rise. These are the cracks in the system that AI is perfectly positioned to help patch up.
So, what does this actually look like for a patient? Well, the best way to really get it is to follow a patient's journey, a journey that's being completely reimagined, from the moment you feel perfectly fine to long after you've recovered. We can break this whole new journey down into 3 pretty clear stages. It kicks off before you even think about seeing a doctor, it continues inside the hospital walls, and then it extends long after you've gone back home.
Okay, let's start with self-care and prevention, because this is where AI fundamentally changes the game. It shifts the balance of power, putting it directly into our hands. We go from being passive patients to being active drivers of our own health.
And this isn't science fiction, you know. We're talking about an AI coach on your phone that helps you manage something like diabetes, or an app that creates a diet plan just from a picture of your lunch. Your watch suddenly does more than count steps. It could actually predict your future health risks. This is personalized preventative care right there in your pocket, 24/7.
All right, so what happens when you actually do need to go to the hospital? This is where AI really steps into that co-pilot role, streamlining everything behind the scenes and giving clinical teams incredibly powerful new tools to work with.
Just look at the impact here. You've got AI chatbots scheduling appointments any time of day or night. AI-powered diagnostics can slash the wait time for scan results from hours down to just minutes. It can even listen to and transcribe a conversation with your doctor, freeing them up from endless paperwork so they can focus on you. This isn't just about being faster, it's about making the entire hospital smarter and more responsive. Now, for a part of healthcare that, honestly, is often overlooked, recovery. You know, after leaving the hospital, it's so easy for patients to feel a bit lost or disconnected. Well, AI is now bridging that critical gap, extending care all the way back to your own home. Imagine this. Instead of just a pamphlet, you get a full AI-powered program that guides your rehab right from your living room. Your smartwatch keeps an eye on your vitals, and it alerts your doctor if anything looks off in real time. Your phone's camera can even check to make sure you're doing your physical therapy exercises the right way. This continuous loop of care is a total game changer for recovery. Okay, this all sounds pretty incredible, right? But it brings up the biggest question of all. How do we make sure this powerful technology is rolled out the right way? I mean, having the tool is one thing. Using it wisely is everything. This is it. This is the critical question, because without the right guardrails for safety, ethics, and effectiveness, even the most powerful technology in the world can fail to deliver on its promise. The absolute #1 principle, non-negotiable, is patient safety. Every single AI tool has to be rigorously tested and validated. And remember, the goal is always to augment the clinician, to give them superpowers, not to replace them. The human expert, the doctor, always has the final say. And, of course, none of this works without trust. Patients have to know, really know, that their sensitive data is secure,
And doctors need to understand how an AI is making its recommendations. You can't just have a black box making these calls. Transparency is absolutely essential.
Finally, and this might be the most important piece of the puzzle, we can't forget about the people. You could have the most advanced AI on the planet, but if it disrupts how doctors and nurses work, and if they're not trained to use it, then it's basically useless. Getting this right is as much about people as it is about technology.
So, if we can get those guardrails right, where is this journey ultimately taking us? What's the big, long-term vision for a healthcare system powered by AI?
Well, experts see this happening in 3 phases. It's not a light switch, it's a journey. It starts with enable. That's building the foundations and getting everyone up to speed. Then you embed. You integrate AI into the daily routine until it's just a standard tool. And the final phase is evolve, where AI helps transform and connect the entire healthcare ecosystem. And all of this is building towards this big idea called intelligent healthcare. And just notice, this definition isn't just about tech. It's about people, services, and industries all coming together to uplift human abilities, not to replace them. That's the real heart of the vision.
So ultimately, this is about getting beyond a collection of single apps or disconnected tools. The future is a truly integrated ecosystem where the whole patient journey, from prevention at home to treatment to recovery, is one seamless, personalized experience.
And as Lalit Mistry from KPMG puts it, AI's greatest power is connecting the dots. It can spot patterns in these enormous piles of data that no human ever could, and it turns those insights into smarter, more responsive care for every single one of us.
And so we end with this thought. The technology is here, and it's ready to be our co-pilot. But the direction we fly, the destination we choose, well, that's still up to us. It's a shared responsibility for all of us, clinicians, patients, and policymakers, to work together to chart a course toward a truly healthier future.